All right, again, I'm back. I want to shed some light on the schizophreniform disorder as defined by the DSM 5 tier. When I introduced the brief psychotic disorder, I already explained what DSM 5 is, which is really the Bible or the standard method that we use for diagnosis. This is for study only purpose. It's not a diagnosis. It's not a diagnostic process that I'm presenting here, but these are some of the symptoms that we would be looking at. So when you're talking about the schizophreniform disorder, is characterized by a combination of symptoms, and some of those symptoms include, just like they're written on their hallucinations, delusions, disorganized speech, disorganized behavior, and negative symptoms, obviously, that persist for 1 month and not less than 6 months. So you remember the brief psychotic had the similar symptoms, but that only was for 1 day to 1 month. But after 1 month, we stopped calling it brief psychotic disorder. So that is the difference. So if someone is experiencing the symptoms, at least 2 of the symptoms below would be considered as having schizophreniform disorder. Again, there is a much longer, much more complicated process before you give a diagnosis. You have to be trained, you have to be licensed to do so. So let's look at the delusions, which delusions are obviously false beliefs that are family held despite evidence to the contrary. So for example, you have a client who comes into your office. His name is John. John is convinced that there are aliens that are monitoring his every move and plotting to abduct him. So John spends a lot of his hours devising strategies so that he can run away from the aliens, despite there's no evidence that can support these beliefs. Somebody else who is living with John might not be able to see what John is talking about because these are delusions. So the second symptom would be hallucinations. So hallucinations involve perceiving things that aren't actually present. For example, so imagine hearing voices that seem to come from nowhere, commanding you to do things. An example would be Jane says that she hears her deceased father's voice telling her to harm herself or harm someone else. So whenever she tries to sleep, she can't sleep because she's hearing her dad call her, or her beloved call her. Or you could be hearing voices from God. People say that they heard God speak loudly. And of course, you cannot confuse that with the spiritual beliefs that people have. We're talking about the medical part of it, of the psychological part of it. So the other symptom would be disorganized speech that usually manifest as jumbled or incoherent communication. So Sarah says, jumps from one unrelated topic to another during conversations. She could be talking about her mother, then she starts talking about her school, but they are not correlated. So making it very difficult for you as a clinician or even her roommate to understand what or even to follow Sarah's train of thought. So she may create new words or use of language that is not usually used according to the, maybe the cultural language that is used. That's why we have to be very, very careful when you're talking about symptoms that people have, because it could be, it's based on the words that they use in that community. So the disorganized behavior involves unpredictable or purposeless action. So like throwing cards. Mark is exhibiting disorganized behavior when he dresses inappropriately. Maybe it's cold weather, like it's winter, and then that person is totally wearing things that are not meant for cold weather. Maybe it's they're wearing summer clothes and it's very, very cold, it's ice outside, and that excuse me, that person could also be wearing school uniform while they're supposed to be going to the office or things like that. So not necessarily just the weather, but meaningless, also the meaningless movements, like they want to pack their bags and carry them for hours, so they are collecting everything that they have in the house and moving them, putting them in the car and driving them, or even coming to class. When, if you're a college student, somebody brings their pots and pans to class. So the fifth one is the negative symptoms. Also talked about the extremely disorganized or the catatonic behavior. Of course, that one is involving, just aimless movement of the body. The negative symptoms refer to decreased or absence of normal behaviors and functions. For example, you might have someone, their name is Emily. So Emily once used to enjoy socializing with friends and pursuing her hobbies, and she would laugh in class, she would make fun, and all of a sudden Emily is withdrawn from any social interaction. When you make jokes, she doesn't laugh, and lacks motivation to engage in any activity she used to enjoy before, and of course struggles to express emotions. So this examples, they're just to provide these. I'm not using the names that I have used here. They are not real client names. So I'm just making up words or names to give you examples. So this really summarizes the symptoms that you might see in a client that is experiencing the schizophreniform disorder. And of course, remember the difference between this disorder and brief psychotic is because the symptoms have actually lasted for a month and above. That is the major difference. So if this ever came to an exam, it's very important to recognize those signs and symptoms, and the difference in duration. That's really what sets them apart. So thank you for listening. Again, I am going to give a disclaimer. This is not a diagnosis that you can make to a client. Of course, there is a longer process, the differentiation, making sure that these symptoms do not meet another criteria, disorder or something like that. So do not use my video to diagnose people. They are just symptoms for you, to help you to understand what some of these disorders look like for educational purposes. Okay, thank you so much for listening.